Hi, everybody. My name is Sanyukta Mathur. I'm a social and behavioral scientist at the Population Council. Population Council is an international nonprofit organization that works on health and development issues using social science, public health, and biomedical research. So it's no surprise that for my leadership project, I really wanted to focus on how we can do better research and use it better that in order to contribute to global health and goals and reduce inequity. My organization's tagline is Ideas, Evidence, and Impact. So this topic was particularly near and dear to my heart. I came to the topic really because over the course of my career, I've noticed sort of three persistent challenges in sometimes the way we do research and the way we use it. When we think that we have evidence, but it doesn't really reach the stakeholders that can use it. The research and evidence that is generated doesn't actually meet the knowledge gaps of programs and policies. And there remains a sort of siloing by knowledge and information by health areas or by geographies. And the cartoon on the right is, of course, a joke, but it really does reflect a lot of times the perspectives people have of researchers that we gather information, we extract it, and then we leave. And this is something that I think we really need to break ground in order to enhance both how we do the research and what we yield from. So to delve into this a little bit, I did a review of documents within my organization as well as spoke to a few key colleagues who both US and non-US based to better understand their perspective on this issue. I'm going to share just three really high-level insights from them. One was actually that we didn't have a consistent language or terminology in talking about this issue. We talked a lot about research impact, but also words like research utilization, implementation science, and operations research, dissemination, evidence synthesis use, and even localization were being used in how we talk about both knowledge generation and knowledge translation. The second was that I think despite that language, there was some consistency in how we wanted to do this work. One, that we saw all of the work to emphasize going beyond just the basic dissemination, meaning beyond putting a publication or presentation out there. All colleagues emphasized the importance of interaction with key stakeholders, and that was really needed for buy-in, whether they be global leaders or local leaders. And that transparency was really key, both in terms of the way we did the research as well as the research findings with those key stakeholders. My colleagues also pointed to 5 other key considerations and challenges they have faced. One, with the organizational culture and whether or not there's explicit conversations within their teams about research impact. The importance of paying attention to contextual dynamics. So really looking at the history of research with a particular community or marginalized population and their role positionality as a researcher. A few had grappled with the idea of power sharing and how we build research capacity and skills of stakeholders, both in order to do the research themselves or to use it. We all sort of lamented a little bit the funding and project life cycles that often give way to our desire for the stronger and deeper stakeholder engagement. And that is often limited in the limited program life cycles. We also talked internally a little bit about staff capacity and skills and how there are different perspectives, bandwidth, and training to sort of generate and disseminate research at this level, and how we build that as an organization and as a community going forward. Some next steps, I'm going to be sharing some of these insights back with my colleagues. I hope to connect with members of our WomenLift cohort who are also interested in the topic and hopefully maybe pull together a blog or opinion piece on the topic. Just some overall reflections on my journey. It's been a really wonderful experience over the past year. I've learned a lot about myself and the different leadership skills I feel I need to flex. I think it's been really helpful as a cohort for us to really think about our role in global health sitting here in US and Canada and what that means. I don't know if we have answers, but it's been good to have a cohort with whom to grapple with on this important issue. The leadership project has been an interesting experience, even though it was a topic of my own choosing and one that I'm fairly passionate about, finding time to do this. on top of the WomenLift health work, as well as my own workload, was challenging, but I hope to take this forward. And lastly, but certainly not least, the camaraderie and the support of the WomenLift Health Cohort, as well as the team, including the CCL colleagues, has been really incredible, and I've learned a lot from this experience. Thank you so much for listening.